So good afternoon. So right now I'm gonna perform how to attach with using a ventilator via BiPAP with the model LV60. So prior to that, make sure when we go to the clean hold area, before we go to the room, make sure we inspect the ventilator if there are any defects or the connections are being secured or tightened. And then once we're all done with those, we will bring along with us going towards either in the emergency room, ICU, or even the private rooms. And then before that is make sure we're able to wash our hands, and also make sure we check the patient's chart if there are any important information or any settings that the physician would like the patient would be into, and also any information such as what's the patient diagnosis or any important information that you really wanted to know for that patient. So after you read the patient chart, already wash or sanitize your hands, wear appropriate PPE such as gloves, goggles, a face shield or a mask, or even if a hairnet I think, and also a gown to protect ourselves. Once we go inside to the patient's room, of course we always make sure that we introduce ourselves, make sure we greet the patient, or even if the relatives are present, try to let them know what we're trying to do, such as good afternoon, my name is Ian, so I'm here, a student from the respiratory care program. So we're gonna administer or give you a ventilator that would help aid their breathing, especially there are some fluid overload inside their lungs. So this one is a BiPAP machine, so for their own sake to know, this test or procedure is non-invasive. After that, make sure we check the two patient identifiers such as the complete name and date of birth, and then make sure we try to assess the patient, make sure we listen to the breath sounds, try to check the patient's color, their level of consciousness, the vital signs such as the SpO2 and heart rate, and we can proceed in doing the setup. So when setting this one up, make sure this one should be on the patient's side, and then when you prepare the equipments, make sure this tubing, because should be into the humidifier. This one is the inspiration, and then the other one is the expiratory side. So usually expiratory side has this bacterial filter where it would lead to filter all those bacteria out, but once in a while we always make sure to replace it if there are any obstruction to this. And then with this other stuff, they also have this flow connector to measure the flow, and then make sure there's a bag full of sterile water bag that it would help put some adequate water in the humidifier. And then when setting this one up, there's also a heated wire inside the tubing that would maintain adequate temperature, not too much hot for the patient, and also make sure you set the temperature adequately, not too high for the patient. And then first and foremost is make sure you also inspect the ventilator if these auto tanks are full, especially if they need to transport the patient. And then once you try to inspect those, you can proceed in plugging this to the red outlet. So the reason why we plug it to the red outlet is for instance such as there might be power outage, it would act as a backup while we're still using this ventilator. So make sure we plug it up in here, and then make sure we also include the O2 hose. Make sure there are no dangling on it. Make sure you try to click it towards the wall until you hear that clicking sound. And then another important thing to note is when we try to use a BiPAP using a mask, make sure we have different or variety of sizes such as a small, medium, large with us at all times, so that we prevent from going back and forth to the department just for getting the appropriate size. So when measuring this, make sure we have this included on this bag. This one is the small, medium, and large. So while setting this one, make sure you try to put it over to the nose of the patient. Try to check if which one is appropriate, such as this one. So it might be too small for the patient. So definitely this one is the correct size for the patient, which is large. So while setting this one up, make sure you already have this in place. And then with the mask, I'm just gonna show it to you. So assuming I am the patient being put on BiPAP, this one is the Velcro strap. So this one is a cushion where it will help support the patient's forehead from any soreness. And then make sure when we attach it to the patient, make sure that it's not too tight for them, so that it will not prevent any irritation or soreness from their mouth or even for their face. So when putting this over, Just gonna try to demonstrate and show it. So ensure that this big hole should be on this, on our back, on our head like this, and then this small thing should be underneath. Make sure we prevent the velcro from hitting the ears. Should be on this side like that, should be on the top. Make sure we prevent from hitting it on these sides, because sometimes if we hit this strap on these ears, it will also lead to irritation and uncomfortable to the patient. So make sure we try to put this over to the patient like that, and then while we put that over to the patient, make sure we're able to put this in the back of the patient. We can ask some assistance. Make sure that the patient's head is elevated as much as you can, and then while we put over on this, make sure you try to inspect for any leaks or any misconnections, and we can also readjust the mask after we put up on the ventilator. So on this top should be secured on this velcro. Make sure as much as possible it's not too tight for the patient. And then moving on, in here we will know that the ventilator is being plugged in by checking the battery, as we've seen this lighted color, and then when turning on we have to press hold for this. So it might take a matter of seconds until a minute. So with this, for example, we try to view it in the chart. Either the physician ordered what appropriate settings, or maybe the physician is on the patient's bedside. They may also try to verbalize what's the order. For example, the physician wanted to have a ST mode, spontaneous time, with a setting of IPAP of 15 over 5 of EPAP, with a respiratory rate of 16 and FiO2 of 60%. So when setting the modes, we have to press the modes in here. Make sure it's highlighted on this, and then make sure we click the mode, and then try to click the IPAP, and then we can also try to set either with this 2 arrow, or we can also try to dial it with this on top, depending if which one are you comfortable with. Once you're all done with that, press accept. At all times the IPAP should be 5, press accept. And then if the respiratory rate, the order from the doctor was 16, we can also try to decrease it to 16. And then at all times make sure you press accept. And then FiO2 of 60%. So once you're all done with this, at all times make sure you activate. And that would know that you're on that active mode by telling it in front of the screen with active mode ST. And also another thing to note is that we have seen in here, these are the waveforms, the pressure, flow, and volume. So make sure we're able to notice that for any inappropriate waveforms or leak. In the side is where we can notice the alarms present. We can also try to silence the alarm, reset the alarm once you are ready to troubleshoot it, like that. And then also important thing to note is we have the alarm settings. The purpose of the alarm settings is a safety mechanism where we can know if it's too high for the patient, too low for the patient, where it would set an alarm off, so that way we can immediately respond. For example, this is the heart rate, respiratory rate, the high and low respiratory rate. We can try to change it up as long as it's not too much for the patient. The tidal volume, because we're using a mannequin which prevented to be more than 400, so we need to set it up at 400 only, and with a low of 200, like that. And then this one is the peak inspiratory pressure. Peak pressures, especially if you notice this patient have any secretions, increased airway resistance. And then another thing to note, once you're all done, you can just click it either in the menu until where it's all set. And then also another thing is with the loudness, we can try to change it, as we've noticed kind of too loud for us. So the purpose is we need to be not too loud, but as long as it's audible for the nurses in the station, so that we will know that there's really a problem. Most definitely one of the most common problems is leaks. And then we can try to check on top of it. And this one are the monitor for the patient, where we can try to look at it, if what's the patient's breathing, whether it's spontaneous tidal volume, how much leak the patient has. And then once you sense that there's a priority alarm, we can take note there's a high priority alarm which would switch up with a blinking red alarm note. And then ensure that once you're able to put this to the patient, you can also try to put it first on standby mode, where it will automatically standby as we've seen in the video, and then put it over to the patient, and then make sure you restart it to ST mode like that, and then it will give appropriate breaths to the patient. So once you're all done with this, make sure you're able to double check still what's the appropriate setting, just to ensure for safety purposes. And then also make sure that you're able to assess by using this flow chart. Every time we hook it up, make sure there's a flow chart for assessment wise. Make sure you're able to check for any tubings or any too much water inside. Make sure you drain it up, which is one of the reasons there's an alarm of a high pressure alarm because of tubing, water in the tubing. Or as much as you can, drain it so that it will prevent the water to go towards the patient. And then, for example, if the patient would like to be removed, such as they want to eat or they feel claustrophobic, once you remove this one, so that way this alarm would shut up, make sure you press standby, and then automatically after a minute it will switch up to standby like that. And then restart it if the patient needs to be back on BiPAP. And then while you already hooked this one to the patient, make sure you double check for any leaks. For example, if there's leaks, you will notice a sound on the sides like that, or even make sure that the patient is comfortable, and also ensure that you're able to put something on the nose bridge, like a gauze or anything, just to prevent any soreness. And then make sure that the arm deal should be sturdy at all times, prevent from any falling arm towards the patient for any accidents. And then the wheel should be locked at all times, so that way the ventilator will not move frequently a lot. So moving on, after we hook initially with the BiPAP, most of the time we always give or obtain ABG. So for example, we already took ABG. The ABG that reflected was a pH of 7.32 with a PCO2 66 and a PO2 of 82. So definitely, based on that ABG, there's a problem with the patient's PCO2. So most likely ventilation side. So as much as we can, we try to wash out that CO2, make sure the patient will not be hypercapnic. So one of the things that we need to switch up in terms of settings is the rate. So in my opinion, we can try to increase the rate to 18, so that way it would help to get rid of those CO2. So while you try to adjust the rate, make sure you also try to take note also in your flow sheet. Try to assess again for any leaks. Try to check the water if it's too hot, if it's still adequate. Make sure you're able to refill the bag. Make sure everything is all set, no alarms present. And then every time we hook it up, right after initial attachment with BiPAP, or after a few hours, make sure at all times we reassess the patient. Most of all, listening to the breath sounds throughout the lung fields, checking the patient's level of consciousness, the patient's color, their vital signs such as the SpO2, heart rate, and also how the patient's be doing, such as any distress at all. So after we're all done with that, make sure we already get rid or remove all those PPE that we wear, such as gloves, mask, goggles, or even a gown. Make sure everything you're able to wash your hands after that. Make sure everything is dry. Once you're about to go outside, try to communicate as much as you can with the nurse in charge. Try to explain what you're trying to do with the patient, especially if you're trying to increase their respiratory rate based on the ABG. And then if possible, if the physician is there, much better, so that way you can immediately interact with the physician. So I think that's all.